Mechanical thrombectomy, removing a blood clot causing a stroke. When someone has a major stroke caused by a large blood clot, every second counts. A mechanical thrombectomy is a life-saving procedure that helps reopen a blocked blood vessel in the brain and restore blood flow. When a clot blocks a large artery, part of the brain is starved of oxygen. This can lead to permanent disability or death if not treated quickly. Symptoms of this type of stroke happen suddenly: facial drooping, weakness in an arm or leg, trouble speaking, difficulty seeing, or a severe unexplained headache. If you notice these signs, call 911 right away. In a mechanical thrombectomy, a stroke specialist inserts a tiny tube through an artery in the wrist or groin and guides it up to the blocked blood vessel in the brain. Using advanced tools, the doctor carefully removes the clot and restores blood flow, often within minutes. The goal is clear: save brain tissue, improve recovery, and give patients the best chance at getting back to their lives. Mechanical thrombectomy has transformed stroke care. Fast action saves the brain and can save lives.